In our last video, we talked about how magnesium can be incredibly beneficial, but only when your body can actually handle it. If someone has compromised kidney function, for example, taking magnesium supplements can backfire in a big way. Instead of helping your health, it can overwhelm your kidneys and lead to a dangerous condition called hypermagnesemia. And this isn't just some minor issue. We're talking about potentially life-threatening complications like serious arrhythmias and even heart attack. After that video, a lot of you asked a very important question. How do you actually know if your body is overloaded with magnesium? What are the warning signs that your body isn't safely excreting the excess magnesium, and instead, it's starting to build up and cause trouble? That's exactly what we're going to uncover today. In this video, we'll walk through 9 shocking signs your body is taking in far more magnesium than it can handle. These symptoms usually happen when your kidneys or other systems aren't keeping up with magnesium processing like they should. And the last 2 signs we'll cover are some of the most serious, so make sure to stick around until the very end. Before we dive in, if you find this kind of health content helpful, please hit that like button and subscribe to the channel. It helps this video reach more people who might be unknowingly putting their health at risk, and your support means the world. Now, let's get started with sign number 1. Brain fog or confusion. One surprising, but important, warning sign that your body might be overloaded with magnesium is new-onset brain fog or confusion after starting magnesium supplements. Now, this is key. If you didn't have issues with brain fog or mental clarity before taking magnesium, but you've started to notice it since adding the supplement, that's a potential red flag that your body isn't processing the magnesium efficiently. Here's the science behind it. When magnesium builds up in the bloodstream, especially in people with reduced kidney function, it can disrupt the delicate balance of electrolytes in the body, including calcium and sodium, which are essential for proper nerve signaling and brain function. Studies have shown that elevated magnesium levels, known as hypermagnesemia, can slow down nervous system activity, resulting in symptoms like confusion, drowsiness, and cognitive impairment. Now, to be clear, magnesium deficiency can also cause brain fog, so the context matters. If brain fog was never an issue for you before, but it started after you introduced magnesium supplements, that's when you need to take a closer look. Of course, brain fog and confusion can also come from other causes: dehydration, poor sleep, blood sugar imbalances, even stress, so it's important to look at the full picture. But if this symptom pops up alongside other signs of magnesium overload, that's a signal your body could be struggling to handle all that magnesium. 2. Nausea. Another common and often overlooked warning sign that your body might be overloaded with magnesium is nausea. Now, here's the important part. Not all magnesium supplements are created equal. Some forms of magnesium, like magnesium oxide or magnesium citrate, are much more likely to cause stomach upset, especially if taken in high doses. But if you're using well-tolerated forms like magnesium glycinate or magnesium malate, nausea shouldn't normally be an issue. So if you started feeling queasy or experiencing nausea after introducing magnesium, and especially if you're using one of those gentler forms, it could be a sign that your body isn't processing the magnesium properly, either due to impaired kidney function or simply because you're taking more than your body actually needs. Of course, nausea can happen for many reasons: a stomach bug, certain medications, or even stress. So it's not automatically magnesium overload. But if nausea is new for you, it started after adding magnesium to your routine, and especially if you're using a gentle form like glycinate or malate, that's a big clue your body might be struggling to handle the amount you're taking. In that case, it's definitely worth rethinking your dose or even getting your kidneys checked. 3. Reduced reflexes. Now here's a sign most people would never think to connect to magnesium: sluggish or reduced reflexes. Think about this for a second. When you accidentally touch something hot or step on something sharp, your body instantly reacts. You pull your hand back or lift your foot without even thinking. That lightning-fast response happens because your nerves and muscles are working together in perfect sync, and magnesium plays a critical role in that process. But here's the catch. Too much magnesium floating around in your system can actually slow that reflex down. Why? Because excess magnesium can suppress the excitability of your nerves and muscles, almost like putting your nervous system into low-power mode. In fact, research shows that hypermagnesemia, when magnesium levels climb too high, can blunt deep tendon reflexes, the very reflexes doctors test by tapping your knee with that little rubber hammer. And while a slightly slower reflex might not sound like a big deal, it's actually an important early neurological clue that your magnesium levels could be creeping into dangerous territory. Now, don't panic if you're just feeling a little tired or sluggish. That can come from all kinds of things, like poor sleep or stress. But if you notice that your reflexes feel oddly slower or weaker than usual after starting magnesium supplements, that's a signal worth paying attention to, especially if you're also seeing some of the other signs we're talking about today. 4. Low blood pressure, hypotension. Let's talk about low blood pressure, also known as hypotension, and how magnesium supplements can sometimes push it a little too far. Now, first things first, one of the best-known benefits of taking magnesium is that it helps relax and widen your blood vessels, which naturally helps lower blood pressure. In fact, that's one of the top reasons many people turn to magnesium supplements in the first place, especially magnesium glycinate, which is known for being gentle on the stomach and fantastic for heart health. But here's where it can get tricky. If your body ends up with too much magnesium, those blood vessels can relax a little too much. The result? You might start feeling dizzy, especially when you stand up too fast, or you might notice a lightheaded, almost woozy feeling that wasn't there before. In more extreme cases, this excessive drop in blood pressure could even lead to fainting, and that's a clear signal something's off. Now, if you've always had slightly lower blood pressure, that's one thing. But if you start experiencing these symptoms after adding magnesium to your routine, and especially if you're using a form like magnesium glycinate, which directly affects blood vessel relaxation, it's worth paying attention. This is your body's way of telling you it might be getting more magnesium than it can comfortably handle. 5. Extreme fatigue or drowsiness. Excessive drowsiness or feeling unusually sedated is something you definitely shouldn't ignore if you're taking magnesium, especially magnesium glycinate. Here's the thing. Magnesium forms like magnesium glycinate is one of the most calming forms of magnesium out there. That's actually why so many people turn to it when they're struggling with stress, anxiety, or trouble falling asleep. In fact, studies show that magnesium's ability to bind to GABA receptors in the brain plays a key role in its calming effect. GABA, by the way, is the brain's main inhibitory neurotransmitter. It helps slow down overactive nerve signals, promoting relaxation and restfulness. Because of this natural calming action, it's perfectly normal to feel a bit more relaxed or even gently sleepy after taking magnesium glycinate, especially if you take it in the evening. That's a sign it's working. In fact, if you can take a hefty dose like 300 to 400 milligrams and feel absolutely nothing, that could actually be a red flag that either the magnesium isn't absorbing well or your body has built up a strange tolerance, something worth investigating. But, and this is important, that calm feeling should never turn into relentless drowsiness, extreme daytime sedation, or that foggy, can't keep your eyes open sensation at random times, especially if you're getting enough sleep. If you suddenly find yourself nodding off at your desk, struggling to stay awake in the afternoon, or feeling heavily sedated no matter how much coffee you drink, that could be your body's way of saying, "Hey, I've got too much magnesium on board." This happens because excess magnesium can overactivate those calming pathways, effectively slowing down your central nervous system too much. Research has shown that elevated magnesium levels can interfere with neuromuscular function and reduce central nervous system excitability, which can lead to profound sedation if magnesium starts accumulating faster than your body can clear it. Now, keep in mind, drowsiness can also come from things like poor sleep, blood sugar drops, or even certain medications, so context always matters. But if this out-of-the-ordinary sleepiness shows up only after adding magnesium to your routine, and especially if you're seeing other clues we've mentioned in this video, that's your sign to step back, reassess your dose, and possibly check in with your healthcare provider. 6. Muscle weakness. Another big clue that your body might be overloaded with magnesium is muscle weakness, and this one can catch people off guard because magnesium is actually essential for muscle function. In fact, magnesium plays a key role in the contraction and relaxation of your muscles, helping them fire correctly and recover after use. That's one of the reasons magnesium is so popular among athletes and people who deal with muscle cramps. But here's the twist. Too much magnesium can actually flip the script and interfere with the delicate balance your muscles need to function properly. When magnesium levels get too high, it can suppress nerve signals and reduce muscle responsiveness, leaving your muscles feeling unusually weak, shaky, or even slightly uncoordinated, almost like you just finished an intense workout even though you didn't. This is especially concerning if you never used to experience muscle weakness before, and it only started after adding magnesium supplements to your routine. This could be your body's way of saying it's struggling to handle the amount of magnesium you're giving it. Research has shown that hypermagnesemia can lead to neuromuscular impairment, reducing your muscle strength and slowing down reflexes. This happens because magnesium can block calcium channels in muscle cells, and without enough calcium signaling, your muscles lose the ability to contract effectively. Now, muscle weakness can come from a lot of things: dehydration, electrolyte imbalances, or even certain medications, so you always want to look at the bigger picture. 7. Flushing and warm sensation. Another sign to keep an eye on is experiencing flushing and an unusual warm sensation. Under normal circumstances, magnesium can help improve circulation by gently dilating your blood vessels. However, when you take in more magnesium than your body can safely process, these blood vessels can dilate a bit too much. This excessive widening leads to increased blood flow near the surface of your skin, which can cause you to feel a sudden, noticeable warmth and even a flushed appearance on your face and neck. The science behind this involves magnesium's role in modulating vascular tone. Magnesium influences the production of nitric oxide, a molecule that signals blood vessels to relax. While this effect is beneficial in proper doses, too much magnesium can overactivate the process, resulting in persistent flushing and a continuous warm sensation. If you didn't experience these symptoms before starting your magnesium supplements, then this change could be a red flag that your body is accumulating more magnesium than it can excrete safely. Of course, keep in mind that flushing and warmth can also be triggered by other factors like spicy foods, stress, or certain medications. However, if these symptoms develop in tandem with your supplement routine, and especially if they're accompanied by other signs we've discussed, it's worth reconsidering your magnesium dosage and possibly consulting with a healthcare professional. 8. Irregular heartbeat, arrhythmia. Let's start by acknowledging that magnesium is actually celebrated for its heart-friendly benefits. It's often used to tackle arrhythmias by stabilizing the electrical impulses that keep your heartbeat steady. In clinical settings, magnesium is frequently administered to patients with irregular heart rhythms because it supports the smooth conduction of electrical signals throughout the heart. However, when your body starts to accumulate too much magnesium, that same stabilizing effect can flip the switch. Excess magnesium, particularly in cases of hypermagnesemia, can interfere with the heart's natural rhythm. It does this by oversuppressing the excitability of cardiac cells, which can slow down or even disrupt the normal flow of electrical impulses. This disruption can manifest as an irregular heartbeat or arrhythmia, a condition that, if severe, may lead to reduced cardiac efficiency or even more serious cardiovascular events. It's a delicate balance. While a moderate amount of magnesium is crucial for a healthy heart, too much can tip the scales in the opposite direction. Remember, it's also important to note that arrhythmias are complex and can be influenced by more than just magnesium levels. Deficiencies in other key electrolytes and minerals, such as calcium, iron, or potassium, can similarly disrupt the electrical balance of the heart. So, while magnesium overload is one potential culprit, low levels of these other nutrients can also trigger irregular heart rhythms. If you start noticing unexpected changes in your heartbeat after beginning magnesium supplementation, especially if you never experienced such issues before, it's a clear signal to re-examine your magnesium supplementation. 9. Respiratory depression. Perhaps the most alarming, and arguably the biggest, clue that your body is overloaded with magnesium is respiratory depression. When magnesium levels become excessively high, they can begin to interfere with the normal function of your nervous system, particularly the brain's ability to regulate breathing. This interference can slow down your respiratory rate, leading to shallow or irregular breathing, and in extreme cases, it may even cause respiratory arrest. The science behind this is tied to magnesium's role in neuromuscular transmission. Excess magnesium dampens the signals sent from your brain to the muscles responsible for breathing, effectively putting your respiratory system on pause. Clinical studies have demonstrated that in cases of severe hypermagnesemia, the suppression of the respiratory center in the brainstem is a critical risk factor, underscoring just how serious this symptom can be. If you start experiencing any signs of respiratory depression after taking magnesium supplements, especially if these symptoms are new and were not present before, it's a major red flag that should prompt immediate medical attention. Thanks for watching. Remember, while magnesium can offer many benefits, it's crucial to consult with a healthcare provider before adding any supplement to your routine. If you found this video helpful, please like, share, and subscribe for more content that keeps your health in check. Stay informed and take care.